Hi, Samantha Peck, registered psychologist. So in this video, I'm going to be talking about some of the common triggers of bipolar. And knowing what your triggers are means that you can get into the stage of treatment called trigger management. And this is one of, I said in the earlier video that symptoms is really important, but trigger management is probably the most important. And I'm not even talking about the medication side of things. Right now, the first line of treatment for bipolar is medication. Because I'm not a physician or a doctor, I can't speak to the medication side of things itself, but the combination of both medication and psychotherapy is what's considered most effective um, for treating and alleviating the symptoms of bipolar at this time. So, putting the medication side aside, uh, it's not that it's less important, it's actually very, very important. But when we come back to the psychotherapy side of things, trigger management is one of the key components of your overall treatment plan. And some of the common triggers for people experiencing bipolar, there's a large list of it. And a lot of them will be life stressors. So whether there's this disruption or arguments between you and a loved one or family members, if you've been working overtime or working really hard or you're meeting a lot of deadlines, there's increased pressure or stress, perhaps a lack of support at work. You might be experiencing workplace bullying or not feeling even comfortable or safe at your place, or maybe it's even like feeling like you've outgrown the job and you no longer find enjoyment being there, and that's a stress on its own. Travel is a big one for people, and time changes when you change the time zones, because that really disrupts the sleep patterns, and really maintaining a consistent sleep routine is going to be very important, and that's with anybody with mental health. If they want to be healthy, sleep is one of the first things that we want to work on anyway. Some of the other triggers is going to be the caffeine in our diet. This can come in the form of like the drinks that we contain, whether it's coffee or sodas. Those energy drinks, those are a big one. A lot of people use those so that they can work late hours if they're doing shift work, let's say. Shift work is actually one of the bigger triggers for people because that disrupts your sleep. Alcohol is another one, as well as drug use. We really want to limit the use of the alcohol and drugs because it's just going to really intensify um, the difficulties that you have as a result of bipolar. Lack of exercise, extended viewing of TV or media. Um, there might be just, like an overscheduled life or overstimulated life where you're just involved in so many things that there is no real time for rest, and there's no maybe work or life balance or personal life balance versus the life that you share with others. So like everyday obligations just being too much. There's no downtime for you. Social events is another big trigger for a lot of people. Weddings, funerals, gatherings, just a social gathering or a party can be one, because it might be stressful knowing that you have to go there and perform, or it might be actually something that excites you and might get you going into a manic state because you're really enjoying yourself. Which, thinking of that, even like the summer can be a tough one for people because of the increased hours, spending a lot of time outside, getting a lot of extra sun can actually be a risk factor for sending somebody into a hypomanic or a manic state. And then the or the opposite, I was going to say vice versa, the opposite for like winter time when there's not enough sun, then there can be a more increase for feeling more depressive, a more depressive mood. Shopping centers is another one. Even for people that don't have bipolar, it can be an energy drain. And changes in general, when things disrupt our routine, if we're moving, there's a new responsibilities or routines at work, just changes in general can really be one of the more common triggers. And I don't know, I guess I'll leave it here for you then, maybe just to bring some thoughts up as what are the common triggers that you find if you look at your pattern over time when you've had your highs and your lows. What was happening just before that? What are some of the events that led up to that or were happening during? Because the thing with the bipolar and the mood swings is there's a large component of what was happening in your environment at the time that can set off one of the mood swings. So in our work, if you were to connect with me, this will be a large portion is really getting down what are the triggers and let's know them, because if you are If you know that you had 1 or 2 triggers in a week, then you might actually decide to sit back and really reduce any obligations you have for the rest of the week to minimize how many more triggers you expose yourself that week, because you know you're in a vulnerable place where you might actually flip yourself into a high or a low. And so trigger management definitely is a key component of overall treatment.